Hello and welcome to the North Metro SBDC programming.
Have any questions around UPK? I will definitely try to answer any questions about UPK you might have or anything else, but this is the time, so please do jump in. So raise your hand or feel free to unmute, however you kind of want to jump in, but do ask questions while we're covering that content because it's kind of harder to go back. And then also, same as last time, I will be staying afterwards. So if you have a program specific question or something kind of personal that might pertain to your program just individually, feel free to stay after and we can chat about that as well. So we will get started. So this is kind of just a general overview of ECE and some of the different entities that are involved in this. So when you look at early childhood programs specifically, that is kind of the narrow point of the ECE system overall. And then beyond that, you have your local early childhood council. So there was legislation that passed that every county in the state of Colorado is served by an early childhood council. So no matter where you're located, you have a council that should be serving you and supporting you. Different councils operate differently. They're kind of different sizes. Some have various specialities and some are just kind of general. Some are very small because it might be that the counties that they cover only have like 2 or 3 providers, and others such as Denver are specifically very big. We have 450 licensed childcare programs. But your council is an entity that will help pass funding from the state down to the programs. So you kind of see as this widens out that QRIS funding, if you get a Colorado Shines rating, which we'll talk about again in a minute, once you get rated, you're eligible for different funding and different coaching hours. So the councils generally are administering those funds or are giving you those coaching hours. The councils also have navigators, and those positions are there to specifically help you through the rating system. So if you're like, I don't know what this Colorado ratings thing is, like the navigators at the councils are there to kind of walk you through that. Above the councils, you have ECLA, which is the Early Childhood Council Leadership Alliance, and they are kind of the net entity for all of the councils. So when it comes to advocating or, trying to push any kind of funding or anything like that, ECLA kind of is the entity above that. And then above that is the Colorado Department of Early Childhood. And that is kind of a newer entity. They're about 2 years old at this point. So funding came through for early childhood to have its own department at the state. So that's kind of where we're at with that. Since it is newer, there's a lot of different processes they're walking through, rules, hearings, statutes, specifically around UPK, but a lot of kind of general things. CCAP has moved under CDEC. A lot of the things that were kind of under Colorado Department of Human Services have now been under the umbrella of the Department of Early Childhood. So when you're looking at, why is this a rule or why is licensing telling me this? Those kinds of things live in the Department of Early Childhood. Same thing with waivers and appeals. All those kinds of licensing things, trainings, PDIS, all that stuff. The Colorado Shines, people that develop those evaluation systems, all those people are housed at the Department of Early Childhood. And then above that, you have the legislators, lawmakers, the Joint Budget Committee, the people that are kind of making the specifics to present to the Department of Early Childhood to kind of navigate through. So if you want to advocate, usually you end up with the legislators and the lawmakers and the Senate and, your people that represent you, and those people are housed at kind of that legal level over here. Are there any questions about the ECE system or why things are a certain way or where something might be housed? You guys can ask in the chat or on mute. It's a big system for early childhood. And there's also some parts of that that are CDEC, which is the Colorado Department of Education. And so they sometimes have different mandates as well.
Dora, it's clear to me who is my local early childhood council, but who will be the early childhood council leadership alliance for the Boulder area?
So the Early Childhood Leadership Alliance is the state entity for all of the councils. So they might be somebody that offers different trainings, or they might train the councils on how to do something, or they advocate to the state for different funding for providers. So basically the councils are kind of the boots on the ground, and then ECLA can tell the state, like, we're seeing a lot of providers that need playgrounds, or we're seeing a lot of providers struggling with COVID or illnesses or whatever that may be. Like that's just kind of how those things get elevated. The councils rarely advocate to the state directly because it's just there's not a lot of power for the councils in that way. Good question. Okay. And then in addition to that, there's also a lot of community partners. So some of the community partners that you'll see in the ECE system are Early Childhood Servant Corps. So that is run by Lisa Amaro, and she is finding kind of retirees that are willing to volunteer in different programs, either through volunteering in the classroom, so reading a book to children, or doing art projects, just kind of coming in and being volunteers for that multi-generational approach. Or she also has volunteers that can do like accounting or HR or help with policies, different various positions that they've held in the workforce throughout their lifetimes, where now that they've retired, they've got some knowledge that's really helpful to directors. So that is a good entity to check out if you're looking for a little bit of support for your program. There's also the Colorado Children's Campaign. This is an entity really advocating not specifically for providers, but mostly for children, and sometimes those things overlap. They don't generally advocate specifically for providers, but sometimes these things just kind of overlap, and that's what they do. The Early Childhood Education Association is run by Dawn Alexander. That is kind of like the statewide union of ECE. So she does a lot of advocacy. That entity doesn't get funded by the state, so she kind of doesn't have her hand in the cookie jar and can really advocate a little stronger for programs. They offer a lot of different services like Pyramid Plus trainings and things like that. RMEC is the Rocky Mountain Early Childhood Conference, and that's kind of one of the larger regional conferences that's put on by the Denver Early Childhood Council. And that's just kind of an annual conference where there's some vendors and lots of trainings and things like that. And then the Early Childhood Leadership Commission is the entity that is over the State Department of Early Childhood. They don't necessarily have any authority, but they're kind of the recommendation arm. So if there are statutes coming through about ratios or quality or anything like that, the ECLC can do recommendations to the state of what they think that they should do. Sometimes they're listened to, sometimes they're not, but there's a lot of different community partners. Is there any other community partners that anyone knows about that they'd like to share with the group? I'm sure I have not captured all of them because that would probably be impossible. Any other thoughts on that? Is everyone asleep right now? Everyone? Oh, wait. Okay.
Question, Dora.
Yes, ma'am.
How does Clayton fit into the whole big picture?
Great question. So Clayton generally is a research entity. So they do a lot of research and like tools to fidelity. So they'll do a lot of certifications for ECHRs or ITERs or class. They have a contract with DPP. So if you're in Denver, you might have a Clayton DPP coach. But generally they do a lot of like research-based things. Like they really like that kind of, it's a blend of a lot of academia with their coachings and trainings. They're really big on the model to fidelity and the research-based fulfillment of the tools. So that's kind of where they fit in. Sometimes they advocate, they're at a lot of tables, but they don't generally push very hard.
Awesome. Thank you.
That is, you're welcome. Okay. So now we're going to talk a little bit about funding. Any other questions about the system or anyone that's like, I've heard of this thing. Who are these people? Like any questions like that where you're like, what is this thing that's happening?
Does Colorado have a chapter for like the National Association for the Education of Young Children?
They do. There's the Colorado Association for the Education of Young Children. They have not been very active recently. So they aren't at the table as much as they used to be, but they're definitely around. I think some of those entities, like the leadership and funding, kind of ebbs and flows. So it's hard to have a consistent presence in ECE because it's hard to get that kind of funding, especially for those kind of outside agencies like that. But yeah, it kind of comes and goes. Good question. It's a lot of them. There's a lot. If you're thinking of starting a program, or even if you have started a program, it's a really good idea to get on all the newsletters. Like, I know it can be really annoying, but you miss a lot of trainings and a lot of funding notifications if you don't have like all the emails from all the places, especially the state's email, like the CDEC's email. PDIS sends out an email of their own. All those things are really important to at least glance through, because there's a lot of opportunities for funding or training or all that kind of stuff. So if you don't get those newsletters, sometimes you miss that. So really think about, I mean, that list I have on this thing, and I'll get these slides. That list is a good place to start, but also Clayton, CAYC, NAYC, any of those things. Like, the more newsletters you have, the more opportunities you'll see come through on your end for funding, training, whatever, and that's really good. You want all of those.
So Dora, you were saying the list of entities from the previous slide than what we're looking at now, but those are good ones to sign up for.
Yes, these are good ones to start with, and also Clayton, CAUIC, any of those. But it's good to at least kind of get on these newsletters so you can see what's happening. And it is a lot. I mean, it really is a lot, but at least, like, if you can book yourself a half an hour every Friday morning on your calendar to just review them, then at least you're aware of all the things going on. Because there's a lot of resources and funding that come through. It's just not, there's not one good channel of all the information. And also your local early childhood council. So if you're in Arapahoe or, you know, Parker, Elizabeth, wherever, like wherever you're at, getting on your early childhoods list is also really helpful, because they'll have local opportunities too. So I would do this list and then also these as well. So CDEC, ECLA you won't have because that's for councils, but then the Early Childhood Council list too. And if you're really into policy, you can look for like the Joint Budget Committee or whatever, but that gets really boring to me, so I don't pay that much attention to that stuff. Cool. Any other questions about any of that stuff? Anything else about systems? Wondering why different things in the system work the way they do? It's surprisingly complex. I don't know why. Don't have a good answer. It's just very difficult for some reason.
I have a quick question.
Yes, ma'am.
So I'm getting ready to open a childcare center, and I know when you reach different levels, you get some funds from, is it Colorado Shines or something? And so when you first open up, do they also provide a certain amount of funds at a level 1, or do you have to wait to become a level 2?
You have to wait to become a level 2.
Darn. Okay.
Yeah, I know. There's not a lot of support or funding for pre-licensing. That's what was generally called the pre-licensing area. So if you need someone to come through and walk through your program, if you need someone to look at your handbooks, like all that stuff before you're licensed, there's very few supports for that. I would use this for that. So if you do have something you need and you want some ECE consultation, then book some consultation with me through this class. And then I can also try to see what other funding sources there might be for that, but it's very challenging. And licensing doesn't usually have the capacity to be very helpful with that either.
Yeah. Okay. Thank you.
You're welcome. Okay. So funding. Why is diverse funding important? Kind of like we talked about with the growth mindset last class, you know, the more diverse and responsive and flexible you can be, the more strength your program will have. So when you have a lot of diverse funding, it makes your financial stability a little bit easier. You can serve more diverse families and more families in general. You can qualify for grants, and you can be more financially adaptable. And all of those things really strengthen like the base of the business that you have. Okay, all the funding streams. I mean, there's more than this. There's a lot of different individual unique scholarships that you might have if you're a Jewish center that's providing services, if you're religious based, if you're nature based, if you're a Montessori program. Like, sometimes there's a lot of smaller entities that have their own funding streams for parents or their own scholarships as a program. These are some of the governmental scholarships, and we will kind of go through these as we go. CCAP is the Child Care Assistance Program, and generally is for low to middle income families that are working or in school. Different counties have their own way that they administer CCAP. So different counties have different rates. Different counties have different activities you're eligible for. So like some might allow job search for 30 days. Some people might allow you to be job searching and have childcare for 180 days. Some might only cover 90 days. It can get kind of complicated, and it's all based on county. So it gets a little wonky. And we'll talk more about CCAP as we go through this. UPK is the Universal Pre-Kindergarten Program. It got rolled out last year, was the first year, and now they're kind of going through what the quality indicators of that program will be. So that's been very interesting to watch. And DPP, if you're in Denver, is the Denver Preschool Program, and that is what UPK was modeled after. That is only for families that are living and going to school in Denver. So CCAP, it's administered by the county of the child's residence. So if the child lives in Adams County, they'll have Adams County CCAP. If they live in Grand County, they'll have Grand County CCAP. It's usually administered through the Human Resources Department of the county that the child is in. So if you are thinking about wanting to know more about that, contact the Human Services arm of the county office. Families that are on CCAP either use ATS, which is the attendance tracking system, or ELV Core to sign in and out. Generally, I don't recommend like different software systems, but if you serve a lot of CCAP children in general, you either have to use Brightwheel or ProCare or whatever and ATS, because ATS is specifically transmitting their attendance data to the county because CCAP is an attendance-based program. So if the child's there, you get paid. If the child's not there, you have a certain amount of absences based on county that you're allowed. So some counties it might be 8 absences. Some counties it might be 0 absences or 1 absence. So it's attendance based. So that ATS system sends the attendance to the county so you can get paid. If you're not using ATS, you can use ELV Core, and that's Early Learning Ventures, and it's funded by the Mirage Foundation. And it is one of the best all-encompassing programs I've seen. So if you're looking for something that does like accounting, because part of the problem is there's so many different accounting funding streams when you really do look at UPK and CCAP and private pay and scholarships and whatever else, like the funding gets stacked up and it's hard sometimes to find a good system to kind of manage a lot of the different accounting and funding streams that you have to deal with. So ELV Core is really helpful for that. And I'll put the full name of that in the chat in case anyone wants to look at that. And they do like, 1 hour things where you can kind of tour through the software and all that. It's kind of nice because they're a nonprofit and they're located in Colorado and have decent customer service. But all of that to say, like they're the only ones that have a CCAP agreement where the attendance through ELV also goes to the county. Because any other system you use, you're going to have to use multiple systems, which is just kind of a lot sometimes. Families are qualified for CCAP based on their income and family size. Again, each county gets its own kind of chunk of CCAP money. So they determine, we want it to be 220% of federal poverty level, or we only want it to be 100%. However it is, like they're basically, each county is getting its own chunk of CCAP funding and is kind of figuring out where they want to incentivize different funding to go and which families they want to serve and what activities they want to cover. So it does make it very different based on the counties that you're working with. Parents do pay a portion to your program, and that is called your parent fee. So somebody might get, a $7 parent fee where the parent is paying only $7 and the county is paying the rest of it. So, and it varies based on the income of the families. So some people I've seen have like $450 that the parent pays and CCAP pays the rest, and some pay like $7 and CCAP pays the rest. If you have families that are on TANF, that is called Temporary Assistance for Needy Families. It's a horrible name, but if you're on TANF, you can also qualify for CCAP as well. So it's basically covering, any of the low-income families that are going through the county. Full-time for CCAP is 5 or more hours a day. So if you're taking a CCAP child, whether they're there from 8 to 1, or if they're there from 8 to 6 at night, like it's going to be the same rate for you. So that's kind of how we get into stacking, and we'll look at that a little bit later, but you can see how you kind of want to try to stack up different parts because there's a lot of different programs that don't pay for like the full day that we know that children are using. How to begin serving CCAP families. So if you want to start serving CCAP families, or you're starting a program or whatever that may be, Contact the counties that your families live in and request a CCAP fiscal agreement. So let's say that I am a program in Denver and I notice that there's a lot of children coming from Adams County. I'll reach out to Adams County and create a fiscal agreement with the billing office. Creating a fiscal agreement does not mandate that you serve a certain amount of CCAP families. It doesn't mean you have to have half CCAP. It doesn't mean you have to serve any CCAP families. It just means if and when a CCAP family comes to you and wants to enroll and you have the space for them and you're willing to take them, then you already have an agreement all set up and they'll send you the paperwork and you'll be good to go from there. So you can have multiple fiscal agreements with a variety of counties based on where you're located, and it doesn't really do anything. It just says that you are able to serve CCAP families if they come through the door. Asking new families if they know about the program and encourage them to go to their county office and apply. Sometimes families do qualify for CCAP and they don't know how to apply, or they've just never thought about it, or they don't know about it, especially families with really young children, like they just haven't encountered early childhood yet or how to pay for that. So it is really helpful sometimes to recommend that families go down there and see if they qualify, because it can save them a lot of money. The parent fee we kind of already talked about. The county will pay you on a weekly basis based on the attendance of the children. And yes, it is probably about 6 weeks or so behind. So it's always like 6 weeks behind in paying you, because that's just, by the time they do attendance and all those other things, that's just kind of how that rolls out. The higher level your program is in Colorado Shines, the higher amount CCAP will pay you. But again, those amounts are based on the county and what the county can afford to pay. So in Denver specifically, I should have wrote this down somewhere. In Denver specifically, each Colorado Shines level you go up from a 2 to a 3 and a 3 to a 4 is basically $10 per kid per day more. So maybe it's $20 per day at a level 2, it's $30 per day at a level 3, and then maybe it's $40 per kid at a level 4. Like, it can make a huge difference. And that $10 per kid per day stacks up to be a huge financial difference for your program. So I know there's some providers that are just not up for trying to go through Colorado Shines, but it can have like a really huge financial impact on your program. So it's definitely something to think about. Some considerations if you're serving CCAP families, it can increase your eligibility for grants. So if you do want a playground or you want, I don't know, anything really, a curriculum, anything, just a grant overall for funding for scholarships or something for your families, serving low-income families can help you qualify for some of those. Sometimes stacking funding for low-income families can get more revenue than private pay families. And that's because private pay families can only afford to pay so much, and low-income families, you can stack the funding and it can be a whole lot more. It's good ethical practice to provide childcare for families that are working that may not be able to participate. So, if you can, it's really good to serve CCAP families, but there is like some administrative work on that, especially for like that attendance tracking piece. Something else to remember about CCAP, there is the federal rule changed so that the feds want to see CCAP block grants administered more on an enrollment basis instead of attendance. So I'd expect probably in the next 12 months, CCAP will be more of, you have 20 CCAP children enrolled, so we're just going to pay you monthly, as opposed to this child is only there for 4.5 hours and whatever. Like, hopefully going further into the future, it will be more enrollment based, because that really does help the financial stability. It's hard when you have attendance based funding, because if someone's not there, you just kind of lose out. And that can be really tricky for providers to count on. Any questions about CCAP? Give me all the things. I'll try to answer you. Taking CCAP is good. Yes, Meredith.
Yeah, so we are trying to, we've been evaluating our finances, and we realized that the center that I'm at, we haven't raised our tuition rates or monthly fees since 2018.
Gosh,
yeah,
okay.
So I'm going through the process right now of trying to increase our monthly fee, but we don't want to go over the CCAP limit. because we know that, I mean, I want to say 98% of our families are either free or reduced lunch. So we really are working with families who they don't have deep pockets, and they're lucky if they have a pocket. So I'm looking at trying to increase our monthly fee. And I'm just curious as if you have any, I don't know, any idea, any experience with how long does it take? Like once I communicate to all the counties that we communicate with, any idea how long that it takes to actually get that enacted? Like 6 weeks, 3 months? Like how far do I need to be thinking?
For your CCAP rate to be increased, probably about like 4 weeks or so. When we get there, there's some slides where we talk about the cost of care, and that's really important to think about when you are doing your tuition increases. So when we get to that and I talk about that, jump in again if I don't answer your question or if you want some more information. But we do get to talking about that piece specifically because there's a lot of programs that just don't raise their tuition, and we will talk about that. You do not get rated higher for offering CCAP, but you can qualify for some grants and stuff. Okay. We'll go over DPP very briefly because I don't think a lot of you guys are located in Denver. There's just different families that qualify for this program. It provides tuition credits, much like UPK, modeled after DPP. Tuition credits are based on income, household size, and the hours of care during the day. They also provide funding to programs for quality improvement, much like the state does. So now we're going to talk a little bit about stacking funding. So you can add DPP and CCAP together to the published tuition rate. DPP specifically is a little finicky about this. So if the published tuition that you're charging people is $1,600, you might have a parent fee of $100, CCAP pays $650, but remember CCAP's only paying for 5 hours or more a day, but it's the same rate. So whether you provide care for 5 hours or 12 hours, they're going to pay you the same amount. And then DPP can pay that $850. Total, you're looking at $1,600. Same thing with kind of UPK. Like UPK can stand in where DPP is in this example too. You'll have like a parent fee for CCAP, what CCAP pays, and then what UPK pays. And so that can kind of help cushion some of the stuff. And this is an example of where it might be more financially feasible to kind of stack up that funding for low-income families than to just get what your private pay amounts are. Universal preschool program. So this provides various funding amounts based on hours too. Sometimes the 3-year-olds are covered. As it stands now, 3-year-olds can receive care, but only in the public school system. So if you're a community provider, you cannot get UPK dollars for serving a 3-year-old in your program. It's not great. There's been a lot of like quite contentiousness around UPK. The other thing to keep in mind is that if you're taking UPK and participating in UPK, you're not able to charge above the reimbursement rate the state is giving you. So you have to really think about that. So let's say, I think most programs now, well, for Denver, each county has its own UPK rate. So for Denver specifically, the UPK rate is like $6,000 for that child for the year. You can't get that and then charge the parents, you know, $100 a day. Like you have to figure out what the UPK rate is. So let's say in Denver, the UPK rate shakes out to about $13 an hour. I can't charge the parent more than what comes out to be $13 an hour because then it's not free. So be really mindful on how you administer UPK. Yes.
So in my previous child care center, we did, but it was the difference in hours that we charged them, right? So is that what you're saying? You can't charge more for those hours, but you can charge them kind of above the time of those hours that they're enrolled. Okay.
So you can charge them above the time, but you can't be charging them like $40 an hour for those extra 3 hours during the day because then it's not free.
Okay. Thanks.
Do programs do it? Yes, they do. Are you supposed to? No, you're not. And UPK can be stacked with CCAP. Any other UPK questions? Let's get all the funding questions out of the way now before we get into cost of care. Yes?
Okay, my question is kind of along those same lines because I want to be very fair with what we're doing with UPK because of the funding, that 5 hours and like the 15 hours, so it works out to be 3 hours a day. And we have some families that have extended their care. Typically, we consider that when they extend to our full day, that's our enrichment portion of the program. And it's always been at a lower hourly rate because they're already adding it on to that preschool experience in the morning.
Yeah.
So, but that means that it it's really hurting us financially. And I'm trying to figure out how to balance that with our pre-kindergartners versus our preschoolers. I want to be fair and not seem like I'm trying to overcharge. So we haven't done anything right now. But of course, all of our families took advantage of that great rate. I mean, they're only have to pay like just pennies to extend their day. And so I don't know. It seems like the guidance is so vague. There's not anything hard and fast. You're not supposed to do it, but there's really no definition as to what it's like. And I don't know what everyone else is doing. I mean, is there better guidance is what I'm trying to get to, I guess.
I will say that I probably work closely, like pretty closely with at least 80 programs in Denver, and I have maybe 5 that are doing UPK. Like that's the question. That is the problem, is that you can't make it financially viable. It's just not. Like if you can't charge more on the other end and kind of supplement that, then all you're really getting is that $10 an hour, $13 an hour, whatever, and you can't make a program function that way. Some of the bigger providers in Denver specifically, there were some that were going to lose like hundreds of thousands of dollars a year, like $200,000 a year, depending on like how many classrooms they had. And so they were just said no. Today there was the RAC meeting or the hearing about UPK rules, because now they're trying to talk about the quality indicators for UPK. And so today, Lisa Roy announced that if you're participating in UPK, eventually your ratio will go down to 1 to 10, which has been like a big debate for, I don't know, 3 months now. Because for a lot of programs, if you go licensing right now is 1 to 12. So if you have to go down to 1 to 10 to participate in UPK, not only are you already losing money, but now you're going to lose 2 slots per classroom, or 4 slots if your group size is 24, you're going to have to go down to 20. So I think that also will push a lot of providers to not participate in UPK, which is hard because it's a hard place to put providers. You have parents that are upset if you're not participating, but you also can't participate and make that financially work. And I know I've been in a lot of conversations with the state where we've asked about trying to find a provider that's making it work, and they can't ever give us anybody. So I wish I had a better answer for that, a more hopeful answer for that, but I don't. It is a very hard place to put the entire community. It is rough. It is rough. And it's hard because it really does kind of undermine mixed delivery. You don't have a lot of community programs that can afford to participate. So then that's leading a lot of parents into the public school system. And that's not great for community providers. So yes, it has been a huge deal. I know there were petitions that providers started. Like it has been a whole to-do. It's not fun.
I have a question.
Yes.
Just going back to your council, you said that you guys can do DPP plus CCAP and potentially plus UPK.
Mm-hmm.
Where is the money from DPP coming from?
So DPP is funded by the state of Denver having an extra sales tax, which is something that any city and county can do. Like if you are in Boulder, you could propose that Boulder have an additional tax to go to early childhood. Like that is something any local thing can do. And I think we're going to start seeing more of that.
I mean, that's amazing, having 3 different sources of income plus the parent fee, like, okay, from sell taxes. Okay.
It's
Thanks.
very admin heavy. Like the funding streams are great, but the more you have, there's also like it's definitely admin heavy. I see Crystal saying like charge them a day rate and then subtract UPK funding when billing. So if you do that, you're not supposed to do that, because if what's left over is more than the reimbursement from UPK, then that's bad. Is anyone getting audited for this? No. Are lots of people doing it anyway? Yes, because otherwise they can't make UPK work. But you're not supposed to. The ratios don't help. And yes, it's costing a lot of providers a lot of money. Really, a lot of them are just saying they can't participate. And then they have to explain to the parents why they're not able to provide that. If you can stack UPK and CCAP, at least that's something. And depending on like where financially you end up with that, at least that can be kind of helpful. It's not going great. Other UPK questions? Okay. I don't have better news on that. I'm sorry. We're working on it, but I don't know. It's rough. Okay, cost of care. This is my favorite thing. Okay, this is really important for you guys as business people. So you have to know what your cost of care is in order to figure out what your tuition is. Because if you're making something, there's no reason you would charge less than it costs, right? So if I'm making this can of Diet Coke and it costs me $1 to make it, but no one can afford $1, so I'm just charging them 75 cents, then I'm going to lose money. And that is basically what ECE is doing. If you don't know what it's costing you to serve these children and what that care amount is per child, then how are you making your tuition? Because really, like, then you're just kind of guessing. Like, where is your tuition numbers coming from if you don't know what it costs to provide that care? So that is kind of what you need to figure out. If you're starting a program, if you currently have a program, if you haven't increased your tuition in a decade and you're like, I don't know what it should be, you need to know your cost of care to figure out what it should be. So to do that, you go through your budget and you take all of your total expenses and divide it by the number of children you serve. So if your expenses are like 200,000 and you have 20 children, figure out what that is and then break that down to a monthly amount, and that will tell you what your tuition should be. If you're a larger program, it helps to know what that breakdown is by age. So you want to know, what does it cost me to serve an infant? Because the ratio is lower. It's only like 1-4, 1-5. Like, that costs more to serve an infant than it does to serve a school ager because the ratios are different. So if you know those things, then that helps you break down your tuition and you're really looking at what it's costing you. If you know your cost per age group, it can help you determine your tuition amount should be. There's a federal calculator tool, and it will be, when you guys get this PowerPoint, you can click on this, but this is actually through the feds, and they have a tool to help calculate the cost of care. And so it goes by state. So you can put in Colorado and then put what level you want to be rated or kind of compare what it would look like at different rating levels. But it's a good place to start so that you can kind of figure out what your cost of care is, because you kind of have to start there. So once you know what your cost of care is, there's usually always a gap between the cost of care and what private pay families can afford to pay. Again, like the soda. Cost me $1 to make the soda. Families can only afford to pay me 75 cents. There is a gap there. We can't charge the families more because they're kind of maxed out where they're at, and they are very upset about how much childcare costs, obviously. And then keep in mind, like, the cost of care is just what it costs me to make the soda. It is not what it costs me to make the soda plus some profit. That's not even what, we're not even ever talking about profit. We're just talking about what it costs to provide care. We should talk about profit. One day, maybe we'll get there. But right now, like, tuition is something people are guessing based on what families can afford, and that is not a good way to run your business. So there's also a gap between what CCAP reimburse and what your cost of care is. The cost of care is usually always a lot. But if you can know what your cost of care is, then you can write grants for additional funding, because the way it stands now, this child care funding model is not sustainable. Like, whether it's private pay families or CCAP plus UPK plus whatever, like, it is so hard to get to the cost of care, because right now the cost of care, I talked to one program in Denver and their cost of care for an infant was $3,900 a month. $3,900 a month was their cost of care for an infant. And they're not downtown or anything. Like, it is a lot. But if you don't know that, then how are you finding out what your numbers are? So that piece is really important. Here's some additional models of kind of stacking different things. So if you look at this, once you figure out what your cost of care is, let's say the cost of care for my program right now is $2,400. CCAP's going to reimburse me $800. UPK is going to pay $1,000, which is just in some ideal world. That's not actually what it is. None of these are real numbers. They're just made up. But that leaves a $600 monthly gap. Okay. And that's with stacking low income family funding. Now, if I have a market rate and I have somebody that's a private pay, you know, the cost of care might be $2,400. The private pay can pay $2,200. That leaves a $200 monthly gap. But knowing what this gap is important because that's what you need to find the funding for. And again, getting up to your cost of care, if you charge what the cost of care is, you'd be at zero. Like you would net zero. So you got to kind of figure out like, how do you spin that? How do you get different sponsors? How can you try to write for grants? How do you, explain the situation? I think there's been a lot of interest in companies and businesses trying to support ECE. If you have like a large company where you have 3 or 4 families that are working for the same company, you could go to them and ask them to sponsor a playground. Like we have got to figure out a better plan because parents can't afford it and we can't continue to be sustainable. I mean, we're not sustainable. We can't continue at this rate. If that's the case, wouldn't it be better to be a nonprofit? I mean, you'd have to look at your individual situation, and that'd be something you might want to talk to one of the consultants at the SBDC about. I know that most ECE programs have become nonprofit because they're not making a lot of money. And generally, being a nonprofit doesn't mean you make no money, but you do try to like put what you make back into the program, and that's generally what a lot of ECE providers are doing anyway. So being a nonprofit can help you access some tax write-offs. It can help you, get some different financial support, write for grants, all those kinds of things. I don't know if I would suggest it to everyone, but it might be better for your individual situation, yes. Because then you can take donations. The nice thing about being a nonprofit is then you can go to that company and say, hey, will you donate to create a playground for us? And if they say yes, that is all a tax write-off for them. And that's a good way to kind of get some kind of support for your program. I don't have great news on the funding front, guys. I wish I did, but I do not. Okay, more about the published rate. So CCAP and other funders might ask you for your published rate. I would suggest strongly that you use your cost of care as your published rate because why would it be anything else? Why would your published rate ever be a rate where you're losing money? Like, why you just wouldn't ever do that? Like, it is just a horrible business practice. Your cost of care, if not cost of care plus profit, should be what is listed. And yes, that is going to be astronomical because the cost of care is very high. Now, having said that, when you're giving that to funders or whoever, at least that is your cost of care and you know that. So you can write to, let's say, Buell and say, hey, I'm writing for a grant to help cover some of the costs of care for my parents. We live in a high need neighborhood or area or whatever. We know that our cost of care is $3,000 a month. Obviously, our parents can't afford that. So we're trying to help cover that gap between the cost of care and what parents can afford to pay. Therefore, we want a grant for $20,000 or whatever that may be. On your tuition sheet where your cost of care is published and it's crazy high, you can put that so that parents know, because that's the other thing, a lot of parents don't know that what the cost of care is. They only know what you're charging them and they think that's a lot. They have no idea that most of the time what the tuition rate is that is published is what a loss is. Like they don't understand that you can only charge them what they can afford to pay. So they don't understand that part, which is why the cost of care is really important. So I would suggest in your tuition sheet that you put, this is our published rate. This is the cost of providing care for these ages, whatever. And then at the bottom, you can say, we're fortunate to be able to receive some additional funding through community funders and partners. The rate may be adjusted based on availability, or make a sliding scale, or whatever you need to do to let parents know, like, yeah, childcare is really expensive. But we do have some different things we can do, let's kind of talk about it. What's your income? Do you think you qualify for CCAP? We do have a sliding scale. Let's look at that. Or maybe put on your tuition sheet, a sliding scale is available. Talk to the director. Something like that. But you should not be going around ever posting that your tuition is less than what it costs to provide care. It's just bad. That is my TED Talk. That is my whole rant about the cost of care. It's very important. Questions? Discussion? Someone else talk for a while? Anybody? Have you guys thought about the cost of care? Do you have any thoughts around this? Would your parents just like faint if they saw the cost of care? Like, where are we at?
Dora. I know also, I live in Douglas County, and just I have, I have a lot of networking that I've done with other people in other counties, and just the rate also changes from counties as well. Like
Yes.
we are more expensive in Douglas County, which is a blessing, but that's just something that I've noticed when talking to other providers, that the different counties does have an effect on what the rates are as well.
Yep. And that'll impact your cost of care too. Like what are the property taxes in the area that you're located in, and how much is your mortgage or the rent on your property, and where are you with trying to get groceries or supplies, and how much can you spend on those things? I'm opening a daycare and I have no idea how to start considering what my cost of care will look like. How can I get a suggestion? I will use that federal tool for that. And so we're going to go in a breakout room in a minute, and I'll put that federal tool in the chat because that's something you guys can kind of look at. That's a good place to at least get a start. Like it's a good place to kind of get an idea. And that's pretty helpful. Most certainly. Okay. Oh, good. Now you guys can talk. What do you think about the cost of care? Have you calculated? Welcome back, everybody. I'm so happy you guys have your cameras on and you're participating.
I'm sorry. I'm sorry. My name is Morena. I'm cooking. I'm cooking.
That's fine.
I'm cooking and I go like, then I don't want them to see me that I'm cooking, but nice to meet you. And I was with Miss, what's your name that you are in the class? With Miss Crystal and Miss Trisha. And thank you, Miss Dora, for letting me to have the opportunity to be in your class. It's very important to talk about the education and everything, but we was talking with Miss Crystal about the rate payment they have in Denver, Colorado, that is very low. And why that is very important. The kids, they are more important than anything else, to at least to pay very good to the teachers.
Yeah.
Even the CCAP or whatever. I don't know, when I hear all of these and I go like, I got my house, my own house. And sometimes I would like to try to get my own business about that. But sometimes I go like, if they pay very low in a school, how much the parents they would like to pay to a private daycare and home, more secure for the kids. And you have to get all the deals about violations, or you need this, you need that, and you need to spend a lot of money to get your own business stuff. And then one day and another, the people that don't want to pay you the right amount for the kids. I'm sorry too, but that's what I was concerning, and I was hearing everything about CCAP, about how much the cost to have a daycare, because I work in a school, but even I have my own house. Everything right now in Denver, Colorado is very expensive.
Mm-hmm.
And I'm glad that I already pay off my house back, even like that, just a month ago. But I'm still not, I go like, I cannot make it with $21 an hour, $20 an hour. And then the only privilege that I have is that I have all that benefits that you really need it, because I'm 55 years old. I'm old maybe than everybody else in the class that you have right now, Miss Dora. But that's the only thing that I have in that school. I have 401k, I have a life insurance, I have a health, vision, ears, vacations paid, holidays paid. That's the only thing that I like it. Because if I have my own business, how I'm going to get vacations, how I'm going to get this and that, don't you? Or what do you think about that, Miss Dora?
I mean, I think really, honestly, like I have been in ACE. I was an admin for like 10 years and I've been doing like business coaching stuff for another 10 years. Part of the problem is that we don't know what the cost of care is. Like it matters because when there's market rate surveys, like the CCAP rates are set based off of what people say that their rates are that they're charging. But people are only charging what families can afford. So if you got a survey and it said how much is your tuition, you're going to put what you're charging, but you're not putting what it actually costs you to provide that care. And that's why it's a problem. Like that $21 an hour, like that's barely even livable in Denver, but UPK is reimbursing like what averages out to $10 an hour because providers don't know what the cost of care is. So you're only saying what people can afford, and that is a different number than what it costs you. And what it costs you is a different number than what you would need to charge to make a profit to live. You know,
Right.
like the cost of care is just break even. It is not what it should be, because if you were really a good business model, you would make some money and you'd be like, well, you know, it costs me $1,000 a month and I'm going to charge $1,500 a month and I'm going to make some money. That's not how ECE works. And it's unfortunate because there needs to be more empowerment about knowing what it costs you, because these rates come from a place. They come from market surveys. They come from the state asking providers what they charge. They come from the tuition sheets you guys submit to CCAP. Like it comes from a place, and it's coming from what you guys are charging. But what you guys are charging, you're caring, loving people. You're charging what people can afford. You're not charging anything that has to do with profit, and you're probably not charging what it costs you.
Correct, Miss Dora.
So, like,
I'm
be
agree
a
with
coward. Find the number because it matters.
Yeah. Because when you trying to get your own business by yourself, you need to get out of your pocket a big money about the toys, about all the regulations and a statement that the state required to have your own business in your own house. And then, okay, it's okay to get all of that, okay? The thing is that when you tell the price to the client, they will go like, that's too much.
But that's where you say, like, what it costs us is this, but we have a sliding scale, or I can work with you and let's see if you can take CCAT. Like, just because that's what your tuition is doesn't mean that's what you need to charge, but you need to know what that number is.
Yeah.
I mean, if some parent calls you, it's okay to say, well, you know, the cost of care for us is this much for an infant, toddler, whatever, but we have a sliding scale, we have lots of funders. Most of the times, parents end up paying whatever. Like, it's okay to say that, but if parents don't know, like basically all these parents are getting like a 25% discount and don't even know it, and they're mad because it's expensive, but they don't even understand that they're getting a discount. So how are they going to know that if we don't know what it's actually costing us?
Yes, Miss Dora, because another thing to know is to be a private nanny. They don't want to pay more, because I have a family. They already bought a big mansion house, $3 million, and they don't want to pay more than $25 an hour. How come? I go like, kids are very important, Miss Dora, and for me, it's hard to believe that you want to try to charge more than $25 an hour, and they go like, oh no, it's the same thing like in the internet, 37, 35, $40 an hour, we can't. And I go like, okay, I mean, it's hard.
I know. It's
Even
just going to take steps.
Yep. Thank you, Miss Dora.
The funding part is very depressing, guys. We'll try to do something more fun going down the line, but like It's not a great time.
Yeah.
Anything else you guys talked about in your groups or other topics, different things? Does anyone here know what their cost of care is? Yes.
Oh, I didn't know if you were okay. Well, I just had a quick question.
It just says like Jay Blaznak, and I'm like,
Yeah,
I don't
sorry.
know that.
I was thinking I have to change that somehow. I don't, but I just had a quick question. I was just curious, but I really don't want to take us down a rabbit hole. When you're looking at staff compensation on the other end, because we're trying to keep costs low, and I think a lot of us are in the same boat where we want to increase salaries, and I've been talking to some other people about this when they had the workforce grants. Those grants were wonderful, yes. But the problem was, and everyone's a little gun shy, grants go away. And so for that workforce grant, we tried to do as much as we could through just like one time, I can't think of the word, but, like just
bonuses and stuff.
Yeah, and bonus. Yeah. There we go. and that's what we tried to do, retention bonuses, things like that. But it still doesn't help for raising salaries because, again, you don't know if that grant's going to be renewed. And I know that there's been a lot of focus groups and that are looking at this problem, coming up with solutions. And I also know that there was a scale as to where they would like to see the variety of levels paid. And I looked at that and I'm like, that sounds fantastic. How are we going to get there? And I was wondering, like, as in these discussions, in these focus groups, something like workforce subsidies that would be paid to help offset the cost, not necessarily grants that you can't rely on or count on, but then to help us get that professional pay for these teachers to match the qualifications we're asking them to complete. So I just didn't know, I mean, in all of those, like in those focus groups, where are we with that? Is there a solution? Is there something, or are we all just kind of talking in circles about the problem?
I think we're talking in circles about the problem. There seems to be two wings of thought. One is that childcare should be considered like a workforce support and should be paid for by the government as a right, kind of like universal health care, that childcare should be paid for that way. But the way that UPK is rolled out and like these quality things and the ratios and kind of this top-down thing, and now they're going to have some curriculum mandates or whatever, like now it's becoming like, okay, well, we'll give you some money that's kind of bare bones and it's going to come with a bunch of strings with it. Like, now that people have seen how UPK is rolled out, I think the hope that the government will kind of not bail us out, but like support us, like I think that hope has gotten kind of tarnished with UPK. The other end of that is like, well, can we get companies and corporations to help support with childcare? And it's interesting because part of my job has been to help different companies think about that. So I've worked with like DIA, I talked to the Denver Zoo, like some bigger companies that are like, if we could get childcare on site, we'd really get some employees here. And so they've had me like do draft budgets with them. And once they find out that ECE is basically a losing thing, they don't want to do it anymore because they're like, well, we can't just lose money every month. Like, I mean, yeah, right? This is a bad business model. Yeah. I mean, it would help them with retention and recruitment, but once they see that it's not profitable, it's hard for them as a company to justify that. It's like, yes. So I don't know. I don't think anyone's going to come save us. But it's going, I know the state just got a compensation grant, so we'll see how that goes. I don't know. It's depressing. Meredith?
I'm curious as to whether or not part of the issue we might be having right now is that there's a big difference between what child care is. And I love that we're using the term child care. I'm glad that we're using we're putting the daycare in the back. But UPK, if my understanding is correct, isn't UPK, it's just supposed to be like a taste. It's just supposed to be a little bit of schooling before you go to kindergarten, correct? Like, it's not supposed to be childcare. It's just supposed to be a little bit to help get kids prepared for kindergarten, or is there a different focus that I'm not aware of?
So UPK was marketed to taxpayers as a free full day program for the year before kindergarten. So when they were trying to get people to vote for it, basically the deal was they would increase the tax on tobacco products, and that would help cover UPK and create a free universal preschool program that would cover full day the year before kindergarten. However, like that just didn't work out that way, because what they consider full day, we all know is not full day. Even at 30 hours, that's not full day, because parents drop off at 7:30 to get to work at 8, and then they get out of work at 5 and they don't pick up till 5:30. So like that's not working that way. And UPK was built on a funding model built to decrease. Like the increase in tobacco products, they were hoping would decrease the use of tobacco products. So you're building a funding stream hoping that it will go down. So then, like, that's not going to work. You know what I mean? Like, they were increasing the tax on tobacco products to decrease tobacco use, and that tax they were putting somewhere pretty to fund ECE, but it's built on a model that should decrease over time. So basically, what it was marketed to taxpayers as and what it's turned out into is not great. It's not great. None of it is great. But yes, really start local. Like if you can find a local funder, especially if you're in like a rural part and there's a huge industry there, or a lot of your parents work for a certain farm or industry or factory or whatever, like if you can try to bring some business in, even if you're like, would you be willing to cover half the tuition for your employees? Or have you thought about how to even just going to an HR individual of a large company that is in your community to say like, hey, I've noticed we've served a lot of families that have worked here, or how are you thinking about supporting your employees with childcare? We know it's a big issue right now. Can we work together to think about how we could do this? Like start locally with who you're serving and try to branch out from there, because this like top down thing with the state is just like it's just a mess. Anyway, one day we'll get to a happy topic, but it's not today. Speaking of salary, so in the college shrines process, they want to see that you have a salary scale that is done by education and experience. I'll send out a template for this too, so you guys have this. Every time, specifically in Denver, this has been a challenge because minimum wage keeps going up. So now minimum wage in Denver is $18.29, which is just crazy, but whatever. So if you think about, if you hired somebody with no education and no experience, that would be minimum wage. And if you hired somebody with a master's degree and like over 15 years of experience, what's the most you can pay somebody? Then you can kind of fill in the gaps with this. And if you use this like salary scale template, then when you do go through a rating, this will all be set for you. And then you can also have some additional initiatives, so incentives, I'm sorry. So if they have conscious discipline certification or infant class or toddler class, or if they're bilingual or whatever, you can kind of put some different parameters on increases potentially for their salary there as well. So I'll send you guys out this template just kind of to have if you guys want to use it, but it can be kind of helpful when you're looking at that, and it will count for your rating as well. Other things you can do around salary scale, this we're using from Bright Beginnings. They gave us permission to kind of use it. Obviously, this is starting very low, but it kind of gives a good map of like where there is like a career path for individuals that are interested in this, and that's pretty helpful too. So even just creating something like this, I really like the salary scales because it has transparency in it, especially with this one, because in ECE, it really is just small incremental amounts. And I have seen teachers just bounce back and forth across the street for like a quarter more an hour, which I totally understand. So it's helpful for them to see like, well, I was thinking about getting associates. I don't know. Should I do it? Should I not do it? Okay, well, if I do it, I know I'm going to get paid 50 cents more an hour or whatever that is. And that's good for them. Like that is transparent. It's equitable. Everyone can see what it looks like. So I think those things are really good and helpful. Questions on salary scale? Questions about anything? I did put the link to the federal tool in the chat, so feel free to use that. Now we get to do something kind of fun, maybe, hopefully. Less depressing? Anything less depressing would be great. Yeah. All right. So this is just some things to think about for the culture of your program. I know not all of you guys are child care centers, but whether you're a family home or if you're thinking about starting a business and kind of thinking about that, this culture piece has been really big for recruitment and retention. We know that you can only compensate so much. And so the second thing that keeps people in the programs that they're at is really the culture that is built around them. So we're going to talk a little bit about that. The culture of your program matters because it has a huge influence on whether or not people stay. And if you have a positive culture, you can really keep people, even if they might make more money somewhere else. So that's really thinking about their wellness, trying to do that work-life balance as well as you can, making people feel valued and heard, helping them, participate in decision-making, things like that. When the adults are happy, the kids are happy. So the more your staff is valued and cared for, the more they'll stay. I know when we got the stabilization grants in the state, whatever that was last year, there's a lot of people that couldn't do the salary increases because it wasn't sustainable, lots of bonuses. But one of the things I talked to a lot of providers about was increasing their staff lounge area. Because if you think about it, like throughout the day for a teacher, they kind of start their day, they go in the lounge or a rest area or whatever you kind of have, the teacher space. And they make coffee and then maybe they get a snack or whatever. And they sit there and they talk to their co-teachers. And then they go teach. And then on their lunch break, they're kind of in this lounge area. Like, do you have snacks? Could you get a coffee machine? And those are things that you can really do to like increase the physical space. And also parents love to help with that kind of stuff. Like if you order the parents some pizza and ask them to paint, even if you're a family childcare home, whatever, like parents love to do that kind of stuff. So if you've got some areas that can be spruced up, like those are some things that we can do with the culture that are not specifically like financially tied for. Or if there's a restaurant locally that might be willing to donate lunch for your staff or whatever, especially if you're a nonprofit, then they can donate to you and they can write that off as a donation. So it's definitely something to think about. Some of the main causes of job dissatisfaction. We've probably all experienced some of these because that's kind of how it works. A lack of appreciation, being or feeling like you're underpaid, which I feel like most of the staff feel like they are, inadequate management. Something that I've noticed specifically with directors and leaders in ECE and owners is that they go from being a teacher to trying to manage a business or being a director or managing a bunch of adults that can be very much like managing children. Like, there's training in that you don't get. And so I think a lot of directors kind of struggle with that a little bit. Limited career growth prospects. So when you think about it, like there's not a lot of places to go. Like maybe you get to be a director, but if you really don't like managing a bunch of people and a lot of gossip and like the things that come with that, then where do you go from there? Like you could try to be a coach. Like there's just not a lot of places to go. I was reading the other day that ECE and factory work are the only two jobs left where you have to ask to go to the bathroom. And it's totally true. Like the work environment of ECE is a struggle. Lack of training and development options, that's definitely not a problem in ECE. Workplace relationships, work-life balance, and then the job isn't interesting or meaningful. I think we've seen a lot of that with teachers and just kind of getting burned out. So it's something to keep your eye on. So I think I might skip this breakout room because I want to make sure that we have lots of time to get through the rest of this. So we're just going to skip that. Culture of care. NACCE recommends the culture of care, and it's really similar to nursing, surprisingly. Like nursing and ECE have a lot of tie-ins together. So just kind of being mindful of professionalism. I think that's really hard in ECE because we have like a younger workforce generally, or like a kind of inexperienced workforce. So they have a really hard time like understanding why it's important to be on time. And because they're in a classroom, I don't think that they think as much about like what they're wearing or the words they're saying, or it can just be a struggle sometimes to rein in that professionalism piece, which is why having policies is really helpful and getting some buy-in around those policies. Like, so what do we think is okay and what do we think is not okay? Like, do we think it's okay to wear spaghetti straps? Like, is that big of a deal? Like, what do we want to look like? Who are we serving? Do we have like really high income families that would be like very traumatized and offended by spaghetti straps? Or do we feel like it's important that we're comfortable and maybe we just wear like some aprons over it or something? Like having some buy-in for that professionalism is really important. That respect, that like shared understanding and value of people's skills, the positive communication, which can be really hard sometimes because teachers are exhausted. Everybody's tired. Parents are cranky, the kids are cranky. There's just a lot of challenging behaviors. It is a lot sometimes, but trying to maintain that positivity, supporting each other, and then also being really inclusive and valuing people for who they are and what they bring. So toxic culture warning signs. This is kind of fun. It's less depressing than the funding. Okay. So if there is no clear sense of purpose, if you have staff and they're like stuck in Groundhog Day where they come in and they don't really care and then they leave and they're just like so over it, they might need to be visited with. Maybe they need a training. Maybe they need a passionate retreat. Maybe they need to go to a training for something they really care about, social emotional training, a language training, whatever that may be. If there's hostile relationships among staff and or parents, that's something you can't really avoid. But like, how is that handled? Is everybody listened to? Are all the parties respected? Those kinds of things. An emphasis on rules over people. So if it's like, nope, it's 9 o'clock. We don't let people in late. That's it. We're done. Nope. Like, there's got to be some kind of gray, and there's got to be some kind of, we care about people. These are our parameters. Next time, maybe it can be late once a month. Like, trying to kind of find that balance is really important. The absence of honest dialogue. If your culture is a place where you don't feel like teachers are coming to you or parents are coming to you with issues or something, and everyone's kind of scared of you, that could be a problem. That could be bad. More self-preservation than collaboration. If you notice teachers are just kind of out for themselves and everyone's just kind of edgy, that's not great. Active back channels, so people talking to everybody except for the person that's in charge. Punishment instead of recognition. So if you're more punishment based and punitive instead of celebration, recognizing, like, you want to feed what you want to see. So you want to recognize, award, employee of the month, like, give that positive reinforcement because that'll help you get what you want. People not feeling safe, whether that's, psychologically safe, mentally safe. Because we have a younger workforce, they experience a lot of like young relationship challenges and DV and, pregnancy type issues. Like, there's a lot of stuff that goes on. And so you really want to create a place where you care about your staff and they feel safe being there. A small group controls the culture, the little gossipy things. And if there's an absence of risk, if it is just Groundhog Day every day and you're never doing anything new and you're never doing anything challenging, that's not great. I'm going to skip this one too because I feel like I want to get through this. Okay, we'll just have a long breakout at the end. Okay, so part of your role, whether you're a family childcare home or in a center, you're the one that shapes the culture with your parents, with the kids, and also with your staff. So plan for the unexpected. Every day in ECE is just crazy. There's just crazy things that happen. There's kids that bite. There's parents that are angry. There's people that fight in parking lots. Just every day is like a new adventure. So be mentally flexible and create that culture around you. Like, well, yep, I guess this is what it's going to be today. I'm going to order everybody a pizza. Like, try to foster that flexibility as much as you can. Monitor progress. So if you're doing fundraising or you're going through a rating or you're trying to get all your staff up in PDIS or something, like, think about that and really make sure you celebrate the progress that you're seeing. Model what you want to see. Sometimes that's really hard. Sometimes it's really hard to walk in every day, be like, hello, how are we doing? Because you guys have hard days too. You get stuck in traffic, you have accidents on the way, your kids might be crazy. It's hard, but you've got to try to like be transparent and vulnerable, but also show up and be the way that you want your staff to be. Reinforce what you want. Be willing to have hard conversations. I think we're seeing a lot of staff in centers, particularly, that are really struggling with difficult staff, and they won't just let them go. Because we have workforce challenges. We can't just find another person to replace them tomorrow. But sometimes when you're keeping those toxic staff, it's making your long-term really good staff leave. Or if you have a child and it's just this toxic child that you just can't, their parents don't want to help or whatever, you've got to like reach out and get them help. Or maybe you need to tell them that they need to find somewhere that can suit their needs better. Sometimes you have to have those challenging conversations to move your program forward. And it can be really hard. The nature of people in ECE is not generally very confrontational, but you have to sometimes, because that's just, you have to do what needs to be done for your program to grow. Support and nurture your staff, make people feel valued. Don't just give that like FaceTime checkboxes thing. Really care, Oh, hey, how's your child doing? I know you said the other day that they skipped class or something. Teenagers, I know, right? Like, really pay attention to what your staff is going through so that they feel valued and connected to you. And then connect and align resources and needs. If your staff's willing to be vulnerable and talk to you about issues they're having, or families, whatever, like, really help them. You know, you are there as a support to either that family or the staff or all of these people. Like if you hear about somebody in a DV situation or you hear somebody might get evicted, you know, do some work and help them try to find some resources and help them out and show that you care about them and that they're valued. Changing a negative culture, it's hard. Make sure we're not the ones being toxic. I cannot tell you how many directors I have trained where I know that their staff is miserable and then they sit in my trainings and they're like, I don't know why I do this. I don't feel like I need this. And I'm like, that's bad. You probably need this. If you don't feel like you need to be here, you could be the problem. So check your own interactions. And it's okay if, you know, directors are busy. So you walk in the door, you've got 50 teachers, they're on your face, or your family trap at your home, you've got like 5 parents all coming in at the same time. It's okay to be like, okay, guys, hold on. I've just got to put my stuff down, just breathe for a second. Hold on. Okay, I'll come back to you. Or like, let's come back to that. Or you know what? I just walked in the door. Let me check on that for you and we'll talk about it at pickup. Like check your own interactions and make sure that you're doing everything you can do and modeling what you want to see. Build other people up, choose to trust. So there's some people that make you earn their trust and other people that just trust right away until you break their trust. Try to be trusting of your new staff and try to really believe and have faith in the people that you're serving. Have those courageous conversations, focus on what can be changed. Sometimes you just have to accept that this one teacher just cannot get their act together to be on time. And for some reason, it is just like really a struggle for them. Maybe they need to be the closing shift. Like, how can you creatively support this person? Because sometimes you just work with them and you have to accept like this person is just going to wear the spaghetti strap shirt, even though I keep telling them not to. But when they get here, they're amazing in the classroom. And maybe I just need to accept this and just not fight this battle. I don't know, like what can be changed and what's worth the fight. Refuse to give power to toxicity. So those loud people, those loud parents, those ones that are always droning on, try to just steer yourself away from that. Or do what you can, but just, you know, if you have to have a hard conversation, do that. We're really trying to build a positive culture here, and sometimes the way you come in and get really loud with my staff can be kind of offensive to them. How can we fix this together? What can I do to support you? Do you need to just take a break for a minute before you pick up your child? Or do you want to just take a minute in your car before you come in? Like, how can I help you come in to like this positive culture I'm trying to build? And how can we work together to make this program better? That like build-in, buy-in is all very important. Be the voice of reason, try to be positive, but don't be Pollyanna if you don't feel like it. It's okay. And then respect privacy of your staff as well. Onboarding, you only get one, I can't spell. Okay, you only get one chance to make a first impression. So you will see these in this. You'll get them in the slides, but I don't have these as separate documents. But if you don't already have a new hiring process, this is something you want to think about. I was reading something that had like 2 different situations. And one is that your friend's having a party with like 20 people that you don't know very well. So you show up and your friend says, oh, come on in. And then she like leaves. And you're just like there with all these people you don't really know. And you're like, okay, well, here I am now. Or what if you went to that same party and your friend was like, oh, hey, it's great to see you. Okay, so the bathroom's that way. The drinks are over here. This is Andy. He also worked in La Petite in Lafayette or whatever. And then this other, and Josie over here loves social emotional stuff. Like she's great at that. I'm going to go check on everybody else, but I'll be back. Like, okay, so I know where things are and I know what I have in common with some of these other people. And I know that I can talk to these people. It's a very different feeling. So think about that when you're onboarding new staff and really thinking about how you're getting them into your program. These are just kind of some different checklists that we borrowed from different programs with their permission, but it is really helpful to see like, okay, 1 and then 2 and then 3 and then 4, and do they do this? And here's my, you know, paperwork for what this could look like. So I really highly suggest you guys review this slide when you get this, so you can kind of see some of these things like day 1, day 2, day 3, day 4. Also, if you don't take the time to onboard somebody correctly and you just kind of throw them to the wolves in the toddler classroom, that's not great. That's exactly like going to the party. You're like, okay, like you have to really work on, okay, this is your co-teacher. Why don't you guys go have lunch your first day and I'll be in the classroom? Like, how can you make that easier and really increase your culture that way? Consider, how are you making your new staff feel welcome and who do they go to with questions? Do they know where the bathroom is? Do they know where they can put their lunch? Do they know the fire drill plan on the first day? Like, what do they know allergies? Because that's like really important. Like, think about Okay. And maybe you have a friend or somebody come in that you don't, well, of course you would know your friend, somebody that hasn't been in your program before. Tell them to come in and say, walk in. I won't be there Friday morning or something. I'll get a coffee. Walk in and see if you're greeted. See how it feels in my program. Do the walls look cluttered? Do the cubbies look cluttered? Is it kind of junky? Does it feel nice? Do you see plants and stuff? Like, get a feel for what other people think that haven't been in your program before, because sometimes having different eyes on just what that culture feels like can help you notice some things you might not normally see. There's so much talking, you guys. Oh my gosh. Okay, offboarding. So when people leave, it's important to take that time to do an exit interview. A lot of times people just do this to check the boxes, and it's so important when someone's leaving. A family, if you're a family checker home, a family, if you're a center, a staff person, whatever, it's so important to know, like, is there something I could have done differently? Tell me about how you feel about how parents engaged in my program. Tell me about how you felt your child's experience was. Tell me about a time our program might have disappointed you. And tell me about a time where you like really felt welcomed and included. Like, whatever that is, use that time as they're leaving, because that was like when they'll be the most honest with you. You know, did you feel like you could talk to me? Did you feel like your teacher was welcoming? Did you feel like, you know, this was a good place for you to be? Or was there times where, you know, your teacher was kind of snappy or something? Like, this is the time where they'll really tell you what you could have done differently, and take that and use it. Feedback and feed forward. Okay, these are two different things. We always use feedback. I also always use feedback, but these are two different things. So feedback is looking at the past. So we had an event over the weekend. What would you have done differently? And we did this event and people got dropped off this way, or it started at this time. And what did go well and what didn't go well. And the person giving the feedback is doing most of the work. It's usually negative oriented, like how could this have been better? What would you do differently? That kind of stuff. It can be really time consuming. And sometimes people get defensive about that feedback. Like, oh, well, yeah, of course, Josie wants us to start at 7 in the morning because that's what, yeah, that's not always helpful. Feed forward is thinking about, okay, it's August. We're going to start our school year. What events do parents want to see this year? What are the things that you most look forward to as a parent? What does your child most look forward to? What can we do in the future? How can we get better with our summer picnic? And like, what are some different activities you'd like to see? And maybe you have some different boxes. We could do a carnival. We could do a barbecue. We could do whatever. Like, it's always focused forward, and the person that is receiving the feedback is doing most of the work. So, you know, sometimes we do a lot of surveys and we're like, why don't the parents give us more substantial answers? It's a lot. Maybe they don't even know what their choices are. If you can, at least do multiple choices and be like, okay, and then leave one open box at the end. Like, okay, please put anything you haven't said in our survey in this box. But other than that, like, do you want to see more social emotional stuff or more materials in here? Or do you want to, like, give them some choices so you've got some good feed forward that you can really use in your program? And then leverage that feedback with the feed forward and let people know, like, okay, guys, so in August we did our survey for this year, and it's September. This is what we heard. This is what we're going to do differently, or how we're going to do it going forward. And it's not so much like past oriented. So I just like this thing, and I think it's important. Employee and family feedback and feed forward. So solicit that feedback regularly. Don't just ask once a year. It's like the toilet paper on the shoe. Tell people right away if there's a problem and get back to them and let them know that it's a constant moving machine. We don't wait till once a year to tell people they had toilet paper on their shoe like back 5 months ago. That's not helping. So keep that cycle of feedback and feed forward always moving. Always ask for suggestions. And this is kind of a cycle of feedback you guys can see. So the first step is gather that feedback. So do that survey, ask parents what they want to see, whatever that may be, get all that information, and then look at that. Oh, a lot of people really hated the carnival and the kids were terrified of the clowns. That's good to know. Okay. And then number 3, decide to take action. Okay, so no more clowns. We're not going to do that. Or maybe it's the Easter Bunny or whatever it is. Who knows? So decide what you're going to do and what you're going to change based on the feed forward you got. And then follow up with your families and say, okay, we heard the Easter Bunny's absolutely terrifying. So we're not going to do that this year. And instead, we're going to do, I don't know, something else. A leprechaun instead on Easter. Who knows? Whatever. But make sure that you're following that cycle, because if you don't follow this, people are going to get like feed forward burned out and just will feel like it doesn't matter. I'm sure as providers, you guys feel that all the time. We're like, I don't want to do another survey. It doesn't matter. Like, you've got to follow the cycle and really keep up with the people that you're serving. In a healthy culture, the leader, which is you guys, will be visible to all the stakeholders. People will know who you are, communicate regularly and purposefully. Always remember that you're a role model. And that doesn't mean you can't have a bad day. It is totally fine to come in and be like, man, I have had the morning from like the bad place and I just cannot be in traffic anymore, or like listen to it. I just need to go like decompress for a minute and then I can come back and I'll be okay. Like, it's okay to be vulnerable and to be a human being. That's okay. But also remember that you want to model what you want to see in your staff. You want people that are passionate. You want to be passionate. Accept responsibility for the school's culture by getting that feedback, feed forward, be organized, try to be as positive as you can be. Again, taking pride in that physical environment. Sometimes we are in a place so much that we don't even see what's around us anymore because we're here every day. So have somebody from the outside or someone that's never been in your program come in. And maybe that's a family that comes to take a tour and maybe they decide to go somewhere else. It's okay to call them and be like, okay, so I heard you chose a different place. That's totally fine. I was wondering if you could like take 5 minutes to just kind of tell me what your impressions were of our program, because we're really working on our culture and we want to know what we could do differently or better, or what did you think of the environment? Ask questions. Make sure you empower people. That kind of gets into some professional development stuff. If you have a teacher that you know really wants to be a director, delegate something. Help them learn. When you delegate, it helps them learn and it helps you not have so much on your plate. There's this weird like control thing in ECE. I don't know why that is. Just let it go. Other people can do like the food program billing. It's okay. You don't need to do everything. It's fine. Demonstrate stewardship, promote professional collaboration, help your teachers work together, share knowledge, all those kinds of things. Focus on the children, have goals and objectives, be going somewhere, because really otherwise you're in Groundhog Day. Pick a project. It doesn't even really matter how important it is. Pick something where you're collaboratively working towards some kind of improvement, whether that's the rating or a playground or fundraising, or everybody has a part to play in a fundraiser night or an auction for the school or whatever it is. Like, always have something you're working towards so that your staff is not feeling stagnant. Okay, we made it to a place. All right, what are your skills as a leader in your business or in the community or in your family? And what are areas you can improve? Where are you like, you know, I really do struggle coming in happy in the morning. I just cannot. Like, how can I help myself figure this out? And then what parts of creating a positive culture are the most challenging? Is it the gossip? I swear, I don't know what it is about ECE, but the gossip is like a whole next level thing. I don't know what goes on, but it's a real problem. Think about these kind of things, you know, like what are the qualities you have and how can you use that? And like, what are some of the challenges and some of the positives? And share with others. If you're like, you know what, we started doing team lunches every Friday and it's been great and people are happy, like whatever that is, share with each other if you have tried anything that has worked specifically well, or anything that didn't work as well, or any, you know, struggles that you have. Okay, so much talking. All right, I'm gonna give you guys like literally 5 minutes. Yes. Okay. Actually, I lied. Hold on. We might just be going on the fly. Okay, I'm just gonna finish this and then we'll do a breakout room. Things to consider: the engagement of your staff, thinking about if you're making a culture of care, career development and PD. If you have staff that are passionate about something, are you encouraging them and supporting them and learning more about what they're passionate about? Or are you just sending them to the same thing you're sending everybody else to that they don't care about? Because that's boring. If somebody wants to be an expert in social emotional stuff, let them do it. That's great. Thinking about how you're onboarding, thinking about that inclusivity, and also think about mentoring. If you have somebody that's a teacher and they're an expert teacher and you can tell they're just kind of like burned out or they're just like they're in Groundhog Day, maybe they want to mentor. That could be somebody that greets your new person that is being onboarded, and maybe that senior teacher helps onboard that new person or every new staff member. And that teacher that is senior is like the onboarding expert or the place that the person that new employees can go to, because then it's not you. Yes, you could have somebody else do that, so it's not you. Growing your staff, support them in long-term success. Sometimes that means supporting people outside of ECE. Some of our people leave to go be nurses or to go do something else, and that's okay. We have them, they're here, they're amazing, and if they need to take classes or something, if we can work around their schedule, then let's do that. Create a transparent path for them to increase their income. That has a lot to do with the salary scale, and support them towards being their best self. And so think about those kind of things. This is a tool. It's really interesting. I like it. You guys can Google it if you want to know more about it. But it's kind of for like career coaching. So you have things that you love, you have things the world needs, you have things you get paid for, and then you have things you're good at. And kind of where these things go, and your purpose is like the middle of all of that. It is the thing you love to do that the world needs that you can get paid for that you're good at. So, like, really, take some time to think about this. I use this all the time with directors that are retiring because they're like, now what do I do? And I'm like, well, let's sit here and think about it. So, check it out. I like it. It's a fun tool. Different kinds of benefits. So, we have the same old benefits here: salaries, raises, benefits, PTOs, bonuses, gift cards, stipends if they do an extra project, tuition reductions for them or helping them find a stipend or a grant for childcare, subscriptions you can pay for. We've seen a lot of calming apps and like Headspace apps and things getting paid for. You can call these app places and tell them, hey, I'm a director, or hey, I'm a family childcare home and I'm really worried about my staff's burnout and mental health. Is there a way you would give us a subscription for 6 months to see if we like it? They'll probably do that. We need to ask, and that could be something else you could delegate to a teacher. Hey, I want you to get donations for our staff, donations of food, donations of gift cards, donations of whatever. Other ongoing expenses for their classroom, for anything like that. Thinking about how to support that work-life balance, accommodating family routines like child pickup. Maybe one teacher goes and picks up all the staff's kids. Like, how can you kind of support them in ways that are not tied to financial things? Other benefits: paid lunch, free food, snacks, employee discounts on anything. Call around in your community and see if there's teacher discounts on things. And then have a list in your little employee lounge somewhere that says, like, hey, don't forget at Michael's you get 20% off if you mention you're a teacher. Whatever. Like, think about those kind of things. You could do on-site manicures and pedicures if there's a cosmetology school near you. Having off-site meetings. Maybe you just take a PD date and you all go to the zoo. Like, go have fun and laugh with each other and build those relationships with each other. Incentives to participate in wellness programs. I've seen people that like are doing this walk to Spain or something. So all the teachers keep track of their steps and they like have these little people that are on the map. Do something silly, something fun, get people to laugh, volunteer for something together, a movie club, happy hour, sporting event, whatever. Provide opportunities for your staff to go talk to each other. Center upgrades, that was kind of more like the teacher lounge room, things like that. And ask the staff what they want. I cannot tell you how much time I've spent with directors where we sit here while they think about what they can provide to their staff. And I'm like, you should ask them. Okay. Sometimes a strong culture means supporting staff even if they're leaving ECE or your program. Helping staff find a professional path to learn and grow is really important, and that makes them feel valued and cared for. And that is a strong culture where people support each other and they care about each other. Okay, last paragraph, we made it. Okay, what are some of the benefits that you've offered that were successful? What's something you've thought about offering, but you're like, I'd love to do this, I'm just not sure how. Is there something outside the box that you've thought about doing? And then is there something you learned in this training right now that you can take action on, which will also probably be your homework. So there you go. I'm going to send you guys to the breakout room. We'll be back probably right at 8 o'clock, and then I will stay after if you guys want to talk or anything. So off you go. Go for it. Have fun. Hello. Stop. All right. Welcome back, everybody. That was probably a lot to try to put into a whole thing. I will remember that next time. Anybody want to share anything interesting, insightful, good ideas, bad ideas?
Thank you, Miss Dora. It's me, Morena, again. I was telling Miss Trista and Miss Crystal that if someday I would like to open up my house that I already pay off, thank God, first of all, because he was the only one to help me, is that I would like to sit down with you, because one thing that I learned from this class is that it will be many foundations that they can help you to go on in your own business. But I would like to sit down with you what's behind that. And I just, because to have my own house that I don't have any more payment, that is something that that is good for me. But after, when one company, for example, Pepsi Center, want to help you with your business, what is behind that? What you have to give them back later on. So those are the concerns that I would like to talk to you personal or maybe on the phone. Thank you, Ms. Dora.
You can definitely set up consulting through the SBDC, and then we can have like one-on-one meetings. And sometimes it's a little easier to adjust like all the personal things and that kind of stuff.
I really appreciate it, Ms. Dora. And it was my help. It was a very helpful this. I'm very happy to be in this classroom.
I'm happy to have you.
Thank you.
Anyone else? Thoughts? Things you learned? Things you didn't learn?
We talked about having like a sunshine committee, putting together staff appreciation type things of just goodies, or I worked in a school where a group of teachers would put on breakfast every payday. So that kind of like staff morale kind of thing.
Yes. Mm-hmm.
I really like your idea, Dora, of talking with corporation to see if they can help. Like, I would love if you have some more information about that, and if you could send me some tips or talking points, that would be great. I also know about the child tax contribution, but I was thinking like Celestial Tea is close to where I am. And you know, a little bit here, a little bit there, it could help. So I just need to go be brave and go and have those talk with them. And I think that's a really good idea.
Yeah. Well, it's in their best interest to help, you know. I think there's some more time we have later on in this series, so I will definitely put that in there, and we can talk a little bit more about how to go talk to businesses, because I think that's great for you guys no matter what's happening. Like having a relationship either for donations or to help with scholarships, whatever that is, like having those community connections is really important. Any other thoughts? I was trying to get you guys out of here early. It was a lie. It did not happen. Okay. You guys are free to go. I will stay here if you need anything. If there is anything where you're like, I want to talk more about this particular thing, please put it in the chat. And then later on in this course, when I have some more time where I'm talking, I can kind of look into that stuff and we can talk about some of those things as a group. If you have specific things pertinent to your program specifically, feel free to do some consultation. Yes?
I have a question. Are we going to have homework for this week?
Yes, so your homework is, what did you learn about the culture of care and what is an action you can take from that? So just put that in the Google Classroom. And then Raul will send out these slides and then also that salary template.
Miss Dora, can I do it by message?
Yes, if you want to email, you can. You're just emailing Raul because he's the one that kind of tracks the homework and stuff.
Please, I really appreciated that because I use my phone. I don't use my computer. Like right now, I'm cooking, I'm eating, and I'm in my class right now. So I prefer to do that in my phone, in the email or text message or whatever you want.
Yes, just email him and that's fine. And just say, in this class I learned about these things that I might do, or if I made a program, this is what I would do, or as a family child care home, this is what I would do, anything like that.
Miss Dora, I don't have your email. Can you email to me?
So you want to email Raul.
Raul. Oh, okay. I have Mr. Raul. Yeah.
Yes. Either email him the homework if you want to email it, or for the rest of you guys, if you want to put it in Google Classroom, that is where it can live.
Thank you, Miss Dora. Have a great night.
You too. See you guys next week.
See you next week. Bye-bye.
Bye.
Hey, Dora, real quick. This is Trisha. I noticed that I think it said if you're outside of these certain cities that we can't set up the consultation. I'm in Parker. I thought it said.
You tried to book it. It said that.
No, it was in the email. The original email. It said it said a certain amount of cities, but Parker wasn't one of them. So I'll go ahead and just try to book it. And will it be with you?
Yes. So you should be able to find me as a consultant in there, and then that should work. If you have any problems with that, you can also email Raul too and just double check with him what's happening with that.
Okay, I surely will. Basically, in a nutshell, I think I mentioned this before, but I've owned my in-home for 6 years, and I have another business that I'm trademarking right now, but I'm hoping to open a facility in Denver, and I'm licensed. Obviously, I'm aware that there's going to be some things that I have to do to, I don't know, transfer my license or how that works, but I think I have questions just to get clarified, and it's a bit overwhelming, all the information. So that's kind of the main reason for setting up a meeting with you, is just kind of getting some clarity around what I'm trying to do.
Okay, perfect.
Yeah, so I will do that. Thank you so much.
No problem. I'll see you next week.
Alrighty, bye-bye.
Anybody else need anything, or are you guys just hanging out? Cool. Okay.